Superhumanize. Accelerated evolution.
What if everything we've been told about addiction is wrong? What if the problem isn't the substance or the behavior, but the pain underneath it? Dr. Adi Jaffe knows this firsthand. Once caught in his own battle with addiction and even spending time in jail, he didn't just rebuild his life, he reshaped the way we think about recovery. A former UCLA lecturer, TEDx speaker, and the author of the books, The Abstinence Myth and Unhooked, Dr. Jaffe challenges the traditional one-size-fits-all approach to addiction and mental health. He helps people break free from destructive cycles not through shame or rigid rules, but by addressing the real reasons behind compulsive behaviors. In this episode, we're going deep, talking about why addiction is often misunderstood, the biggest mistakes people make in recovery, and how we can rethink not just addiction, but transformation itself. Dr. Jaffe, welcome to the Superhumanized podcast. It's really a pleasure to connect with you today. The topic that you have done such a deep dive on in your books and also in your life's work, addiction, resonates with me. And I think it's a hugely important topic. So thank you so much for making time for us today.
Thank you so much for having me on.
Something that when I was looking into your work is that your approach challenges the conventional abstinence-based approach. And so I'm curious, what was the pivotal moment in your life that made you realize that the traditional model is flawed?
It's a good question. If I think about it, there are probably a few moments and not one moment. But as I talk about in the book, I've struggled with addiction myself. And I followed traditional recovery when I was referred to rehab, therapists, psychologists, etc. early on. And that was all that seemed to be available. So this is 2000, 2002, 2003. And like what we all still think of as rehab, right? You go to this house, you sleep there for a while, they take you to meetings all day. That was the model, and it just so happened that the vast majority of meetings that we sat in, inside or outside the house, were essentially focused on Alcoholics Anonymous, 12-step based kind of recovery. So I didn't know anything different. I didn't know that there was anything different. I was in there for about 3 years, and in the middle of that, I went back to school. So to backtrack, went to rehab for about a year, went to jail for a year, then came out of jail and moved on with my life, but went to school to study psychology. There are a lot of reasons for that. We can talk more about that. But I was studying all these things about neuroscience, addiction, psychology, et cetera, and none of them had anything to do with what was presented for me when I was going to rehab. And that started sitting with me in an uncomfortable way. It was like, why are psychologists studying this around addiction and mental health problems? And in rehab, we're told a totally different thing. And just as a basic piece, rehab was about God and admitting that you were sick. Psychology was about trauma and about early experiences and environmental influences, psychological biases, beliefs, all this stuff. And it was like, there was almost no overlap between the two. So that's when I first started questioning what happened to me. Secondly, because of my own questioning, I then ended up moving away from abstinence-based recovery myself. And I started talking about it pretty openly, and I got a lot of pushback. A lot of pushback. People essentially telling me, look, you're relapsing and you're being irresponsible talking about it in this way. And I don't know that I was prepared for that, but I realized that if I was struggling with this and I was a master's in psychology guy who had done the best given how bad things had gotten, right? Heavy meth addiction, jail, all that kind of stuff. If I was getting this kind of pushback, it just made sense to me. A lot of other people are as well. So I started speaking about it openly. And as I did that, it became clear that I was right. There were a lot of people struggling in many ways with this. And that gave me even more motivation to start researching and understanding. Is there something about the current model that is just so good we need to stick with it? Or is there more out there to be desired? And I have to say that over and over, I land on the idea that there's more out there for us to do, and that the current model is just not succeeding at the sort of levels where we would even think in any other field to say, this is a great standard, let's just stick with this.
Yeah. Can you give us some numbers on that? Because I read about it and my mind was boggled about how low the true success numbers actually are.
Yeah, so I'll walk you through the whole chain of why I think this current system doesn't work. So the first thing is most people don't realize how few of the people who struggle with addiction even get help, professional help. And the numbers are around 5 to 8% of people who need it get professional help. That's not true in any other field where there's a medical problem, right? In cancer, diabetes, et cetera, it's 80 to 90% of people diagnosed get help. Cancers, even higher, diabetes, a little bit lower. Hypertension, et cetera, you're still talking 80, 75% of people who are diagnosed get medical treatment for it. Even depression, so people say loads of physical disorders, maybe that's the problem, but depression, anxiety, 60 to 70% of people get help. In addiction, it's less than 10%. Historically, we've blamed the people who have the addiction problem. We say they don't really believe that they need help. They don't understand it. I think it's a problem when you blame your patients for why your treatment isn't working, right? That's an issue. That's the first number. Let's say up to 10%, but like somewhere between 6 to 10% of people even get help. And then the way we measure, and this is a big thing behind my first book, The Abstinence Myth, the way we measure success right now is by complete abstinence at least a year. Less than 10% of people who try traditional recovery right now meet that criteria. Less than 10% of people become abstinent for at least a full year. Some people will give you as much as 12, 15%, but really the easiest number is like about 10%. So now you got 5 to 10% of people that are getting help. Only 10% of those are succeeding, which means we're helping between 0.5% to 1% of the people who are struggling. That is terrible, right? We're not helping 99% of people. So obviously there's a ton of room for improvement, and anything is an improvement almost, right? When you're only helping 1%. The thing I decided to focus most of my time on is how do we get, if only 5% of people are getting help, how do we get 30% of people to get help? How do we get 50% of people to get help? How do we get this more aligned with the other treatments? Because then we don't necessarily even have to make the treatment better, but if 10 times as many people are trying it, we'll still end up helping 10 times as many people. So that's why I focus a lot of my effort, and that's why my books and all the work that I do is really focused on what's keeping people from getting help, and let's just eliminate that. Let's just make it easier. And that's, yeah, that's most of my work.
Yes, and I can tell from your books as well as from speaking to you now that this is truly such a passion, such a purpose for you. And I commend you for it, Dr. Jaffe. And in your first book, The Abstinence Myth, just circling back to something you said earlier in our conversation, you actually also say that addiction isn't necessarily a disease, because just when we started talking, you said a lot of people are being told that they're sick. So if it's
Yeah.
true that addiction isn't a disease, then what is it? And also, why do you think that this disease model still persists so much despite the mounting evidence against it?
Yeah. So I'm sorry, I'm not being distracted, but like you said something that I just want to point out. There's so much hopelessness around addiction, and I think that's a mistake.
Mhm.
I think the reason there's hopelessness is because the way the professionals have been talking about addiction, not actually, not that addiction doesn't suck. Addiction can be horrible, but the way we talk about it, I believe, makes it worse. And I just want to give you an example, right? So I got an email, I have my second book. A lot of the people who bought my second book are people who bought my first book, which is common for authors. But I was emailing back and forth with somebody who bought the first book, and she said she was happy to get it, but I work a lot. And since I read your first book, The Abstinence Myth, I stayed clean with only a few relapses. The first year, she had 2 of them. And the second year, she had 1. And the third one and the fourth, she had 0 relapses. Now, she doesn't write in this email how many times she struggled with addiction and what she tried before. But the reason I'm reading, you were saying it's a mission driven thing. The fact that I can write a book that helps one person get their problem under control speaks to what I was talking about earlier, right? She wasn't going to rehab. There are a lot of reasons. Rehab is expensive. Rehab takes a lot of time. Most of us don't. Who can give up 30 days of their life, 60 days, 3 months, 6 months to go get help? Most of us can't. Unless you're independently wealthy or have a family that can support you or have the best insurance in the country, you just can't do it for both of those reasons. So we need to offer solutions that are easier. And the fact that I could write a book that could take somebody I've literally never met before and help their problem. By the way, notice the first year she had 2 relapses, the second year she had 1, the third and the fourth she had no relapses. So it wasn't until the third year she met a full year of abstinence. It took her 3 years to get there, but she got it from a book instead of a $30,000 treatment center. So now that I know what keeps people from getting help, I'm very committed to saying there are millions. I'm talking like 44 million Americans who could use this help every single year. Why not get them cheap, easy to access solutions that are at least as effective as the current system that is not very effective? But I would argue, hopefully, some of my solutions are at least a little bit more effective. I think they're way more effective, but even if they're a little bit more effective, hopefully we can help millions of people. So that's why the mission is so big for me, right? To get to the disease piece speaks to what I was saying. I think we make a mistake in the field. 80 to 100 years ago, when AA started, being a quote unquote addict or an alcoholic was one of the worst things you could be. We lived in small towns. People had very close knit. Being the village drunk or being the town idiot was horrible. You hurt people close to you. Maybe you were threatened with physical harm, a ton of shame for your family. So the idea of having very religious groups that meet in basements in churches to talk secretly about people's problems was probably better than what was there before. I will fully agree, right? Compared to what else was available 100 years ago, AA was probably a huge step up.
No doubt.
But we didn't know about the brain. We didn't know about the psychology of environmental influences. We didn't understand genetics and epigenetics and the impact of trauma on the human psyche and body. We knew none of that stuff. So they took religion and they put it in a book that is essentially their Bible. And they said, look, give everything up to God. You were sick. You were born sick. You just didn't know it. Now you're sick forever. God will save you. And that's the AA model. It has 12 steps, but if you want it, most of it is own your disease. You are sick. You can't control it. God will save you. The word God is in there over 300 times. Much better, again, just for context, better than what we had before.
Certainly.
But
But
that doesn't mean it's good, and it doesn't mean it's good now. There's a better word for what I see and what I've seen now in thousands of patients and in the literature, et cetera, for what addiction is. A disease is a thing that has a specific biological underpinning. It's a specific condition that is affected by a specific bacteria, virus, malfunction in one specific biological system that is repeated. Everybody has the same thing. If you have the flu, you got the influenza virus, right? If you got a different virus, even if you have a cold, like even if your nose is running and you cough, you don't have the flu because the flu disease is caused by the influenza virus, right? Cancer is a proliferation of cells in your body in an uncontrolled manner. That's what it is. It's a multiplication of cells in your body in a way that is maladaptive and sick and creates sickness. Now, it can happen in your skin, and then it's a problem, but it's less of a problem than if it happens in your lungs or your brain. And if you cut out that little tumor, as long as those cells didn't go anywhere else, you're fine for now, right? You go back into remission. We've never identified anything like that in addiction. We haven't. It hits a bunch of different neurotransmitter systems. Some people get addicted to this thing at a young age. Other people get addicted to something completely different in the middle age. It switches from one addiction to another all the time. The symptoms are relevant. They touch together. So doing something or using something repeatedly over time in a way that hurts you and you've tried to stop it and you haven't been able to are symptoms. They're all symptoms that show up. There's a different name than disease for that. It's called a syndrome. Symptoms that show up together, like irritable bowel syndrome is one example, right? Carpal tunnel syndrome, right? Autism spectrum, that's a syndrome. There are ways to understand there are clusters of symptoms that show up together, but they're not a disease. Why do I think this matters? A disease has a cure, and the same cure should work for the same disease over and over. That is not true of a syndrome because the origin of why you have the symptoms could be totally different. So one client that struggles with addiction could have really big trauma from their early childhood. Another one could have attachment issues. A third one could have a currently dysfunctional marriage, but no trauma in the past. Those people may need completely different treatments. And if you lie to them and tell them that they're all part of the same disease, then what you're saying is the same treatment should work for you. And we've tried that for 100 years and it's not true. So it may seem to people like, who cares if I call it a disease or a syndrome? But you wouldn't treat irritable bowel syndrome and cancer the same way. You wouldn't treat the different cancers even. If there's one type of cancer and another type of cancer might need different medical treatments. And we understand that because we understand that they're different. And I think we've made a big mistake in addiction.
Yes, thank you for summarizing this for us, Dr. Jaffe. And I think what's also really important as well is what you mentioned before, that, for example, in the AA programs, people are told they were born with a disease, born sick, and they're going to have this forever. This is so, first of all, it's so disempowering from a psychological perspective. And then it's also just not, it doesn't give the individuals the correct tools, the correct mindset to actually get to the root cause. And as you have already illuminated, there can be many different root causes where actually then all of these symptoms pop up. And this self-soothing that then turns into a habit, a crutch, or an addiction for whatever reason, survival strategies pop up. So something else that always has bothered me looking at addiction and treatments is, and you still hear this a lot today, that a lot of experts believe that people who are dealing with addiction, they have to hit what's called hit rock bottom before they can change. Now, just as an empathetic human being, that bothers me. From
Mm.
your perspective and experience, is that true? Or is there maybe a different way to approach recovery?
Yeah, great question. I write about this actually specifically in the book. So I'll say I don't like rock bottom for the term.
Mhm.
Most people need a moment of change, a push, I call it a back against the wall moment, an experience that tells them what I've done to date isn't working. I must change.
Mhm.
Now, the reason a rock bottom doesn't matter as a term, you can't recognize a rock bottom when you're in it because there's always opportunity to make things worse. A rock bottom only makes sense when you've now come to the other side of it and it's a year, 2 years, 3 years, 5 years later, and you can look back and saying that was my rock bottom, right? I went to jail for a year. I was facing 15 years in prison. For some people, like myself, that was enough. Spending a year in jail was enough. So I can call that quote unquote my rock bottom. The change actually happened before I went down that path, by the way, though. But other people go to jail, come out of jail, and go right back to the behavior they had before. So there's no definition of what a rock bottom would be. And that's why it's troubling to me. A, a big existential change experience is something you often do know pretty quickly after it happens, right? Life smacks you upside the head, and you go, oh, I may need to reconsider what I'm doing here. Now, the irony, and I joke about this in the book, it doesn't have to hurt, but it's a moment that shakes your understanding of the world. Again, being a little facetious because I know how light what I'm about to talk about is. Most people listening to this right now believed in Santa Claus or the Easter Bunny or Elijah if you're Jewish like I am, or pick any like hero of a childhood that would give you gifts, chocolate, or whatever they did on a specific holiday, right? You believe that they existed for years. Your world concept created a place for Santa Claus to come down your chimney and give you gifts every Christmas evening. At some point, you learn that isn't true. By the way, that wasn't a comfortable learning. It sucked. Whether it was your friends who told you, your parents who finally fessed up, or you found out on your own, it was uncomfortable. Most change moments are. But guess what? You reshuffled your concept of the world and you moved on very comfortably, and you're pretty much okay. Maybe a little disappointed, but you're pretty much okay with the fact that Santa Claus does not exist and the Easter bunny does not hide chocolate eggs for you everywhere, right? Like we've all been through that. But that's one example. Many people listening right now may have read a book, listened to your podcast, listened to another podcast, had some other experience in life where they used to think the world goes this way, but then they realize it actually goes this way. Now, I hope I'm not ruining everybody's day with this, but odds are you will have many more of those experiences. And a lot of the things that you currently think are true, you'll find out later are false, or at least false for now. All that is okay. What I'm saying is, in addiction, typically people need to have a moment where their reality gets shuffled.
Mhm.
Most of those are hard to manufacture because it's like real world consequences coming down to bear on you. But you can create the experiences. So if you go out and you're always searching for new information, you can have that happen, right? You can listen to a podcast, watch a movie, read a book, and have a shift. Those are normally more minor shifts, but sometimes they're major. The other place where I've seen that work is psychedelic work. And whether it's ketamine, which is the most prevalent legal psychedelic to use, people have, especially, I'm not a big fan of the IV dialysis model of ketamine infusion, but there are certainly ways to use ketamine in substantial doses, not microdoses, but in substantial doses that create really big shifts in people's consciousness and make them think about the world and their lives differently. Other psychedelics like ayahuasca and psilocybin and MDMA have similar roles, and they're all different, right? And I can talk about why they're different. But when your life isn't working the way you want it to, I actually call on all the listeners. You should invite in big moments of change. You should push yourself to the edge of where you see your life existing because something isn't working. And it's very likely that if you can shift the way you look at things instead of shift the world, which is much less under your control, you can have pretty big transformational changes in terms of your behavior and how you show up.
Mhm, mhm. Yes, 100%, Dr. Jaffe. And I really resonate with what you said about psychedelic therapy. Actually, one of the companies of my husband's and mine, we're deeply immersed and invested in health and wellness and longevity. And one of the company, Gateway Sciences, has a brick and mortar arm, Gateway Clinics. So we have a clinic here on Montana Avenue in Santa Monica in Los Angeles, and we're focused on extending lifespan, health span, mental health is a big component of that, which is why we
Yeah.
also offer ketamine IV as well as IM intramuscular.
Yep.
And I'm curious on your take. So we have seen over the years that we've been open hundreds and hundreds of patients specifically coming in for the ketamine therapy. And what I have seen that is very beneficial with the IV administration is that you can actually titrate it and really be very specific towards each patient and their needs, and even during the treatment. As in, for example, the nurses can adjust the drip speed, either slow it down or speed it up. Oftentimes, patients are there with their therapists, and as they're working through something and as they're getting familiar with the medicine, it's actually something that I've experienced it myself. It literally is like rocket fuel to bust through something you're working through. From your experience, I would love to learn more about what you said, like what your reservations are
Sure.
with regard to IV therapy and what the routes of administration are that you've seen individuals derive great benefit from.
Yeah. So again, to be fair, what I'm talking about in terms of IV is there are places that use IV like a dialysis
Mhm,
clinic where it's everybody, you'll have 20, 30 people sitting down and nurses coming in and out. A lot less, even if it's 10 patients, a lot less highly individualized care. Um, and also just the setting, right? We know dose set and setting are massively important in any experience, but certainly in a psychedelic experience. And so you get these clients, and I've talked to many clients who come to me after something like this, where the experience is overwhelming and there's nobody there to support them during the experience, and then there's no integration after, and they're left trying to figure out how to hold all the pieces. There's like a Netflix movie playing on a big screen in front of them, and they came in the session in the middle, so it's like in the middle of the movie and they're plugged in and nobody really holds their hand. Now, part of that has to do with cost, part of that has to do with reimbursements. There are a lot of reasons for that, and medical clinics like the idea of sitting 20 people down and they're all getting treatment at the same hour. So you can bill for the same hour for 20 patients. That makes sense financially, doesn't make sense experientially for the client. So that's a big caveat that I'm putting over what I'm about to say right here. For many clients that I've worked with, most of the ketamine session at the higher doses is non-communicative, right? They're often unable to talk, but eyes closed, music in, eye mask, they transition, they move into a different reality almost. And they're they're catatonic. They're not moving the vast majority of time, depending on the dose. Sometimes they're unable to move maybe at some higher doses initially in the session, and then gradually their movement gets released and they come back. So that's one form of doing it. IM mostly happens that way, right? And so different experiences provide different results. If you're at a dose that's low enough where you can actively talk to your therapist, that's a very different experience, but you have somebody there to integrate with you. So one of the most important things is the integration process, almost regardless of the dose and the set, is the integration setting, right? Bringing people's experience into this world when they could have they had a disembodied experience, right? It's a
Dissociative.
disembodied impact, right? It's a dissociative anesthetic. So they've had a disembodied experience. They're not used to that. They've had thoughts that they haven't had before. Many times I have people recollect things from their past that come seemingly out of left field. They don't even understand how they fit in. The integration is there to make that fit. But listen to everything I just said, right? Highly personalized care in a setting that controls your spacing and your exposure. So you can't have too many people in a room. It can't be
Mhm.
too overwhelming, right? You've got to have controlled settings and then time for the integration. That's a that's still relatively quick potentially, but it's not this silver bullet, "Hey, just take this medicine and everything will be fine" experience. That's different than the way some people view these medications, right? Some people hear about psychedelics and they think, "Oh, I take this medicine and then I'm good." But
Mhm.
that's not how psychedelics work. Psychedelics bring up things to then integrate. And that's go back to what I was saying is, and I write about this in the book, that is the one of the few ways I've seen to manufacture a moment of change. Why? Because somebody goes into the experience, and especially if you have a medicine naive client, they've never done any of this sort of stuff, or maybe they partied with this stuff when they were 18,
Mm,
19, 25 years
very
old,
different experience.
totally different experience. Now you put them in a setting like this, at some point, early in the middle or towards the end of the session, something in their brain goes, holy crap. I thought this was going to be what I saw and experienced, but this is what I saw and experienced, right? It's one of those, oh my God, change moments. And now, if you can therapeutically hold a person's hand through that, they're more open minded. They're able to accept things that they weren't able to even look at before because they have seen a side of reality that they hadn't seen just an hour earlier.
Mhm.
And that's when I got the SWAT team coming to my house and arresting me, and then I go to talk to my lawyer and I'm facing 15 years in prison. I'm more open. I'm willing to look at things I wasn't able to look at before. I'm willing to do things I might not have considered before because there was a big change moment.
Right.
Nobody wants to just get people arrested by SWAT teams. Nobody wants to get people near death experiences if you don't have to. Psychedelics are the only other thing that I've seen that can get close to that.
Yes, and 100% agreed with everything you said, Dr. Jaffe. I also think that psychedelics not only hold such great promise, but there is actually evidence, there are studies that show how they can not that just help people feel better, they literally and countless instances can heal. And with regard to what you said about ketamine, I full-heartedly agree with you. For our clinic is the polar opposite of the setting that you described. We're very boutique. We're very focused on the individual. The preparation as well as the integration is key in creating a setting that is safe and just really where people feel nurtured. I think that's so important. And this model that you describe of 20 people in a room, that oh my God, that just sounds like a factory. That sounds so unconducive to healing to me, for healing to me. Oh, and
But by
making
the
it
way, I think it follows less the therapeutic, more the medical model in this country, right? Because if the molecule is what creates the impact, then you just need to get the molecule into as many people as possible. It doesn't respect the experience.
Yeah, exactly. And it's looking at us like machines, and we all function in the same way instead of looking at us holistically. And there's so many interesting compounds, just to button this part of the conversation with regard to
Sure.
psychedelics up. But if we look at Ibogaine, a friend of ours, Dr. Martin Polanco, he offers this in Mexico, where
Mexico, yep.
legal. He has treated thousands of individuals and close to, I think, 800 or 900 veterans, also who are dealing with severe PTSD, with severe addiction. And from what I
Opioid, and primarily opioid.
yes,
Ibogaine is incredibly useful for opioid addiction in
yes,
particular, and potentially for others as well, but that's one where it's very well established.
yes, and where people literally within 24 hours or 48 hours, so one session with this medicine, they not only these addiction pathways in the brains, that's gone, and there's also no, what do you call it?
Withdrawal.
No withdrawal, which that
Yeah,
is
that's one of the biggest impacts of Ibogaine is the withdrawal of opioids is really difficult to get through. And Ibogaine, which by the way, just so everybody understands this though, the Ibogaine experience is not a good experience. It's not. It's a very trying, psychologically stressful experience. And I think people think of these substances, they think always it's a party drug. They think to themselves, everything's a party drug. And I say, I've been in enough sessions now with people bawling, crying their eyes out, scared, where this is not a party, believe me, but it allows you to access parts to yourself that you were unable to access beforehand. And to the point I make in my book, it's those parts, those hurt parts in particular, that need
mm,
to be healed if you're going to treat the addiction, right? Because to take us back to what we were talking about before, if the addiction is not a disease that was specific to the addiction, like nobody is really addicted to alcohol. That's BS. You may be physically dependent on alcohol, but you're using alcohol as a medicine to treat something else. What is that thing? I care much more about the thing you're trying to treat with alcohol than I care about the alcohol. Because
mhm.
if I remove the alcohol and I still leave you with the other sickness, then you're not able to function well. And then you're either going to go back to alcohol, or you're going to find something else to help you heal.
Yes. And Dr. Jaffe, this is you talk about this in your latest book, and this addiction as a response to deep emotional pain. So, what about those though? I have people that I'm close to, even in the family, who, let's talk about alcohol, for example. They're like, oh, yeah, it's been a habit for decades, and now they're going to AA. What about those that don't think they have trauma or pain, yet they struggle with this addiction? Where do they start, especially if they're not?
Yeah. So I want to stay away from the notion that everybody experienced trauma. There's a
Mhm.
huge there's a huge correlation between trauma and addiction. Upwards of 60-70% of people who struggle with addiction have traumatic experience. That doesn't have to be where the addiction started. It doesn't have to be the underlying cause. But the way I talk about it in my book is there are these hooks.
Yes.
People say I'm hooked on alcohol, I'm hooked on porn, I'm hooked on cocaine. And what I say, that's not what you're hooked on, but that is what you use to treat when the real hooks pull on you. So I'll start with my example because I always start out with that one because it's easy, and then we can go to others. I had a ton of social anxiety when I was younger. Um, a lot of people didn't see it, but when I would walk into social settings, I was constantly looking at everybody, trying to figure out what they're thinking about me. Am I looking okay? Am I speaking okay? Am I carrying myself all right? Does my tone sound fine? I literally couldn't stop trying to figure out how I'm coming off to others. I had no ability to enjoy social experiences. I was constantly judging and devaluing myself. And when I found alcohol, I talk about this in the book. When I found alcohol, it was the first time I had that experience go away. I was 14 years old and I went, oh my God, I didn't even know I could feel this calm, relaxed way. And a lot of things happened that night that made me go, okay, I found my medicine. This is great. I didn't know I had social anxiety. I didn't know what the heck anxiety was. I was 14 years old. Nobody had ever talked to me about anxiety, but I found the medication for what I needed by mistake. So I started using the medication. And of course, it became a habit. By the time I was in college, in my second year, third year of college, I was drinking and smoking weed every single day, almost all day, failing out of almost everything I was doing in life. If I talk about this in the book, so it's very an easy starting point. If anybody wants to read it, I talk about some of the exercises to do this. I went back to the first time I ever used, and I was like, oh my God, I know exactly why I used. And I go through that in the book with a few other clients. There was a reason why drinking was attractive to me when I first did it. People say anything can be addictive. That's bullshit. It's not, it's just not true. I've treated thousands of patients. I've never seen anybody addicted to smoking actual grass, right? I've never seen anybody addicted to like drinking sand. We get addicted to things that address dysfunctions that exist within us and they help bridge that gap. People get addicted to opioids, yes, because of pain. By the way, the one caveat I will say is there are people who got put on heavy duty opioids for a physical problem,
Yes.
like they broke their leg, took teeth out, had an injury of some sort. They got put on too heavy an opiate dose because of pharmaceutical marketing. After 6 months, the doctor tried to take them off it, and they're like, "Oh no, I can't do this. I'm now dependent on this." The doctor cuts them out, and now they go into the illegal market. That's a very different problem than what I'm talking about, and there is a substantial enough portion of people who struggle with addiction to fit that category, but it's a small minority compared to everybody else. So again, I just want to say that. Opioids, though, treat pain. It just so happens that the circuitry in your brain that handles emotional and psychological and physical pain is the same. So when we say they broke my heart or it really hurts me when you talk to me like that, we mean that literally. It hurts me. It feels like pain, emotional versus physical pain. So opioids help deal with emotional pain too, right? They numb emotional pain like they numb physical pain. But in the exact same analogy, they don't fix the pain. They don't fix the source of pain. If I break my leg and I take opiates, I care less about the pain, but my leg's still broken. If I have deep social anxiety, or I have deep trauma as a child, or I'm in a terrible marriage where I just feel like I'm hopeless every single day, I take a drug, it treats the feeling associated with the suffering, but it doesn't treat the underlying issue. Just like a painkiller doesn't fix your leg. And so the same analogy to me applies, right? You still have to fix the leg if you want the pain to go away, just like you still have to fix the marriage or your social anxiety, or you still have to do the trauma work to get rid of the addiction because the addiction is a signal. It's not the problem. The problem is underneath the signal. And your leg hurts because you broke it, but the pain is not the problem. The fractured leg is the problem. So I think once we understand that, we look at somebody with addiction and we ask, and Gabor Mate asks this, I'm not the first person to think about this, but Gabor Mate says, why the pain, not why the addiction, right? Because there is something we need to dig into there.
Yes. Oh, absolutely. You speak for my heart as well. And what you shared in your book, by the way, the second book, Unhooked, is also so on point, so helpful. I can't even
Thank
begin to imagine. You mentioned the one example of the woman you've been emailing with, how
you.
many people you're helping. So just huge respect and gratitude for your work, Dr. Jaffe.
Appreciate that. Thank you.
Yes, and what you shared about your social anxiety resonates with me. I used to deal with anxiety. What would you call it? In so many different areas of my life. I
Sure.
knew where it came from, did a lot of work. I'm in a much
Mm.
place now. Social anxiety, though, it can be crippling. I would literally get to a place when I was younger and I would immediately look, where is a bathroom? Where is a closet where I can just hide to calm
Yep.
myself down? And alcohol was also very soothing all of a sudden. And where it actually came, this low self-worth and also self-confidence, and where does it actually come from? I knew over years of work where it came from to actually heal that part. That's where
100%.
that's
100%. And to me, that's the beauty, by the way, of this work, right? Ellen, oh my gosh, the Harvard professor. I just heard her on an Andrew Huberman podcast. I'll get us the name before we're off this. But especially when you're younger, you ascribe so much meaning to, I'll call it, what are relatively menial, meaningless individual experiences, but you put them together into very important indicators of your functioning. Think a specific grade on a specific homework assignment, the way an individual looks at you, stumbling on your words, right? You mumbled something or you stuttered, a lisp, a zit, you fell, your mom yelled at you. Like individual events that on the whole mean very little individually get aggregated into these representations of who you are. And if you judge yourself by outside metrics, and if you have a leading like I did to notice more of what's going wrong than more of what's going, it's very easy to judge yourself poorly. And that's a very uncomfortable way to live. So when people say to me, a little bit in line with what you were just talking about, Ariane, I have generalized anxiety. I said, hold on, what does that actually mean? Walk me through your generalized anxiety. Again, not always, there are always exceptions, but most of the time, there are repeating patterns of that anxiety, right? I'm not good enough. I'm not pretty enough. I'm not big enough. Like for guys, I'm not strong enough. I'm not successful enough. I don't have enough of this. I don't good look good. I'm too big. I'm too small. Oh, and there could be a few of these, but they repeat in this cycle. Now that manifests in a bunch of different ways. So when you go out, somebody looks at you, you think to yourself, "Oh my God, I'm ugly," or somebody looks at you and you say, "Oh, I'm not dressed right. I don't have enough money to impress this person." The way those specific worries manifest can feel generalized, but they're not generalized. They're very specific to you. And what I urge a lot of my clients, as much as they hate it initially, is take a journal, take a note in your phone, and just keep note. What are you really anxious about? Because then let's put the pieces together and we can probably whittle it down to a handful of real concerns about who you are. And now we have something to work with, because generalized anxiety disorder sounds like this really big problem that is really unsolvable.
Yeah.
I worry about everything. If you worry about everything, I can't fix that,
Yeah.
right? Because if I fix it for the first 100 things, you'll have the next 4,275,000 of them. But if you're worried that you don't look good enough, that you're too big and you don't have enough money, and that comes out 50 different ways, let's explore that. Let's understand that, right? Are you really worth as much as you're worth in the bank? Is that really your worth as a human being? Let's understand. Let's unpack that, right? And what I found is you can get, I'll say, a good enough handle on some of these worries where the volume is lower, at least. They don't control your life in the same way.
Dr. Jaffe, you've worked with so many people who've struggled oftentimes for decades and in some cases also lost almost everything. Yet there were also miraculous transformations. Have you ever witnessed a particular transformation that was so profound it changed your understanding of addiction and healing?
It's a good question. Short answer that intuitively comes up to me is yes, and they all challenge my understanding. But that's why what part of what I've tried to do is remove any expectations in terms of what's possible and what's not possible, and just deal with what's in front of me in the moment. Again, those judgments of this is too bad and this is going to be easy are just projections or just judgments of what I've experienced before. But I'll just speak to the point. I've had clients, I've lost two clients in my life, like two clients that I had worked with who either when I was working, was while I was working with him in my clinic, in an old clinic, and another one was a year and a half, 2 years after I'd worked with him. But two clients that I've worked with that I know who passed because of their addiction, mental health struggles. Those are really hard to take, right? I don't know how people work in the ER where you lose people all the time. I have very personal connection with my clients. Those were really difficult. But between the thousands of people I've worked with, and again, that's between groups and talks and one-on-one clients, I've learned no problem is too big, no problem is too small. It's all in your perception of it. I can never really tell how quickly somebody will get over what they have. So somebody with really big issues could be a really quick turnaround, and somebody with seemingly moderate to minor problems could take months to years to overcome. And maybe more importantly, how many times somebody has tried help before and how many times they've quote unquote failed doesn't at all inform for me how easy or hard it's going to be to work with that client. So I'm always trying to challenge and I'm always trying to understand the next thing that is feasible. But I've worked with multiple clients who've been addicted, as you mentioned, for decades, the heaviest level, people who everybody else has written off. And then I'm not going to lie, it doesn't take a week, it doesn't take 2 months, but 6 months to a year, sometimes a little bit longer than that, and massive transformation. Like they're an entirely different person all of a sudden. And those are the most rewarding.
Beautiful. And to button up this wonderful conversation, Dr. Jaffe, if you could implant Let's just speak like in a
Mm,
magical world. If you could implant
yeah.
more belief into the minds of everyone who's struggling with addiction, what would
Mm,
that be?
yeah, probably even bigger than addiction, but I talk about this in the book, so I'm giving away some awesome little tidbits, but this is a good standby. I'm definitely didn't make this up, but authenticity and truth telling,
Mm,
so the opposite of lying, right, are some of our cleanest, easiest, fastest hacks to
mm,
getting the mental health and peace that we want. And that's probably really uncomfortable for some people to hear, but sunshine is the best disinfectant. It's these phrases are there for a reason. And many of us get stuck in this place where, in order to save face, right? Think about what we just talked about. We don't feel good enough about ourselves. So we try to pretend,
mm.
and we don't realize that pretending is actually hurting us more than how badly we feel about ourselves. And so, one of the biggest takeaways in the book I tell people is if you can just stop lying about how you're doing and what you're doing, you will see faster transformation than anything else I can offer. It will suck in the beginning, that will be work to do after, but it's one of the fastest paths I've found to getting you to the other side.
Beautiful. Thank you, Dr. Jaffe. And for those who would like to learn more about you, connect with you, where can they find you?
Yeah. So on social media, it's Dr. Adi Jaffe everywhere, and that's Dr. Adi Jaffe. And adijaffe.com is one website I have. And then if you're interested in the book, there's a website specifically for that called Read Unhooked, READ, unhooked.com. And you'll find out a lot more about that. But obviously available on Audible and Barnes and Noble and Amazon and everywhere else.
Excellent. I'll make sure we put all of this into the show notes as well. Much gratitude for your time and much gratitude for all the good work you're putting forth into this world, Dr. Jaffe. Thank you for coming
Thank you
on.
so much. Yeah. Thank you so much for having me on. This was great. I appreciate it.